and welcome to the webinar this afternoon. It's officially afternoon. My name is Frida Poirier, and I am one of the long-term care best practice coordinators at the RNAO. I will be the moderator for today's webinar. At this time, I'd also like to introduce you to Andrea Stubbs, project lead of the Best Practice Champions program. She will be online to help anyone who has any technical questions in relation to the webinar today. Our monthly webinars is a means of supporting RNAO's best practice champions in their work and guideline implementation. Our speakers are those who are actively involved in BPG implementation. Today, we will be focusing on integrating Falls best practices through partnerships. Before we get started, just some housekeeping items to keep in mind. We want to keep our webinars engaging and interactive, so the presenters may ask the audience questions during their presentation. There will also be a 10-minute question and answer session at the end of the 20 to 25-minute presentation. We encourage you to type in a question or comment in the chat box during the presentation, should you have one. And please, when you do, send your questions, comments to all participants to ensure that everyone sees your questions and comments. We have started to record these presentations so that they can be archived for future viewing with the slide deck on the RNAO website. So moving forward, it's my pleasure today to introduce you to your presenters for today. Wendy Carew. Wendy has over 3 years experience implementing community-based strategies in Northern Ontario. She worked for 20 years as a senior director within the public health system in Ontario. Her areas of expertise include community engagement, research evaluation, policy development, quality improvement, and communication. She currently works at the Northeast Local Health Integration Network in strategy and system planning as the population health lead. Wendy's focus is on integrating population health approaches across the region in partnership with both health and non-health sectors. One of her current projects is to coordinate the regional falls prevention strategy, Stay on Your Feet. And the second presenter with Wendy is Kathryn McLenaghan. Kathryn is a registered nurse and holds a certification in health services management from CHA Learning. She has over 33 years of experience in various roles in healthcare. She is a Canadian patient safety officer and a patient safety educator. Kathryn's areas of expertise include critical care, acute care, cardiac rehabilitation, and secondary prevention, accreditation, quality and risk management, pharmacy management, and patient relations. She is currently employed at the Northeast Local Health Integration Network as Director of Home and Community Care, Nipissing. In Kathryn's previous role, she has had the responsibility as Accreditation Coordinator and Quality Improvement Plan Lead, as well as in her current role for integrating best practices and strategies for falls prevention into policies and practice. I'd like to now open the floor to Wendy and Kathryn.
So Kathryn and Wendy, if you just want to share your screen now.
Sorry?
And we've unmuted you.
Okay. Just wondering why it's not sharing.
Just a reminder to press the share at the bottom of your screen.
I'm sorry, it's we had it shared. What's this one? You're still not seeing it?
No, we're not.
That's weird. I'm sorry.
That's okay. So I will share it on my end, and then you'll just move the slides forward. Just give me 1 second to open it.
All good things, even if you practice, may not always work. Yeah, we were all set up. And So you're sharing it from your end, Andrea?
So you should be able to see it now. Do you see it?
We're still seeing our screen, so.
We can see it, Andrea.
The slide we're on is focus of presentation. Is it something you can move from your end, Andrea?
So I think maybe you guys might just have to refresh your screen or something, because Rita is able to see it.
Okay, you know what, I'll end it. And I will do it again from the beginning.
And we have to switch displays.
Still not seeing it?
No.
Yeah, there's something going on. I think the easiest would be if we could have you just advance the slide so that the participants can see it, and we'll just indicate what slide we're on.
Sure, go ahead.
Okay, so we're past the first slide. We're on to the focus of the presentation.
Mm-hmm.
Thank you.
Okay, so the focus of our presentation today will be on Stay on Your Feet, which is the Regional Falls Prevention Strategy in Northeastern Ontario. And this program is funded by the Northeast Local Health Integration Network that we'll refer to as the Northeast LIN going forward. The work that we're doing around falls prevention and some of the changes we had made as a result of our work with the RNAO's best practice guidelines is actually grounded in this regional strategy. We will also speak about how we had integrated and continued to integrate the RNAO's best practice guidelines, preventing falls and reducing injury from falls, and that's the 4th edition, into our work processes in home and community care. And finally, we'll also speak about supporting system change and how falls prevention best practices connects to the larger overall system. So the next slide, we wanted to give you a little bit of context about Northeastern Ontario. The Northeast LIN's geographical area covers approximately 400,000 square kilometers. And we often hear that this is about the size of Germany. The total population in the Northeast is 565,000 people. And we pulled some stats from 2016, and Ontario's percentage of older adults, and when I say older adults, we mean 65 years of age and over. In 2016, in Ontario, the population of older adults was 16.7%, and in the Northeast alone, it was 20.4%. And we knew at that time that in the next 20 years, or by 2036, the percentage of older adults, 65 and older in Ontario, would be 24.5%. However, in the Northeast, there would be an increase to 30.8%. So that's almost a third of the Northeast population that are considered older adults. And we know that 13.3% of older adults in the Northeast are considered to be living with a low income compared to 12% in the province of Ontario. And for instance, in Nipissing district, as an example, they have 20% of older adults with a low income. And we know that low education leads to lower income, which can contribute to poor diet, potential vitamin deficiencies, and low social supports. Most falls are predictable and preventable, and research does show that approximately 50% of falls happen in the home. The Northeast LIN's Home and Community Care Program is currently serving 8,500 older adults, 65 and older. And we monitor our falls that are documented on the reassessment by our care coordinators using the INTERRI-HC assessment. And INTERRI stands for International Resident Assessment Instrument that is used in home care. And the reason we monitor the reassessment is that when our care coordinators perform an initial assessment in the client's home, they're actually looking then at the risk for falls, so patients' falls risk, and they're implementing strategies to mitigate this risk. And thus it's really important that they evaluate whether their strategies have in fact mitigated this risk and whether they might need to implement additional strategies. We compared our last fiscal year's fall rates during the first 2 quarters to this fiscal year 1920's first 2 quarters. And you'll see on the slide that it says we're an average falls rate of 31% last year in comparison to this year where it's 28%. And that may speak to some of the implementation of action items that we did with our group that we'll talk about in today's presentation.
Thank you, Kathy. So the next slide talks specifically about the Stay on Your Feet strategy. And I wanted to ground this presentation because the work that we've been doing with our home and community care teams here in the Northeast is grounded, as Kathy said, in Stay on Your Feet. So many of you may be familiar with Stay on Your Feet, but back in 2014, the Northeast LHIN decided that they would invest in a falls prevention strategy, and Stay on Your Feet was selected because it's considered a best practice. And we know that older adult population is growing, and it's growing in the Northeast faster than in Ontario, as Kathy pointed out. I think that's good news. I think we're living older and aging hopefully well. What's important though to note is that 1 in 3 older adults will fall, and that may result in an injury, may result in hospitalization. And so when we took a look at our data, our rates of hospitalization and emergency room visits, of course, we were much higher in the Northeast compared to Ontario. So our LHIN decided to invest in a falls prevention strategy. And that investment means that we had a full-time coordinator, myself, in the beginning, and we actually partner with our 5 public health units, and they do receive funding from us on an annual basis. So the Stay on Your Feet framework is from Australia. In fact, we're going to be having a call with Australia in early December. It'll be 8:30 a.m. for them and 7:30 p.m. for us, so it'll be very interesting. It's also based in what's called the Ottawa Charter for Health Promotion, and I'll talk a little bit about that as we go through, and the Queensland Continuum of Care. And of course, it is grounded in the RNAO best practice guidelines, preventing falls and reducing injury from falls. So the Stay on Your Feet strategy really is about making sure that we understand that falls are preventable and that it takes a community to prevent a fall. It's really everyone's business. If you want more information about Stay on Your Feet, our link is there. It's on our Northeast LHIN website. This is the continuum I talked about. It takes a community to prevent a fall. And I just wonder if for those who are online, if you could just type into the chat box, in what area you work. Do you work mainly in the community? Do you work in hospital? Do you work in home support? Or do you work in residential or aged care? So across that continuum, we have a wide variety of activities, and it really is a life course approach. So as we age and become older, we are looking at how do we support falls prevention at all stages of the life course. So if you could just take a minute and pop it into the box, indicate if you're from the community, if that's mainly where you work, or if you work in hospital, or if you are in home support, like home and community care, long-term care. We'll be interested to know who's on our call today. So one of the things that the Stay on Your Feet strategy does, because we are really looking at a full system from healthy, active, older adults to older adults who really may live at high risk and live in residential care, we really focus on how do we create system change. And what's key here, and it relates specifically to the work we're doing with home and community care, home and community care can touch the life of 8,500 older adults on a daily basis. So that's a lot of the population of our older adults in the Northeast. So it's only makes sense that Stay on Your Feet as a regional strategy have a solid partnership with home and community care. And so if we're going to look at changing a system, we must all support healthy aging. And we use the word active aging to mean both physical activity for sure, but also mentally and socially. So active aging to us is more than just the physical component. And many of you will know there's a lot of work being done in the area of social isolation and its effect on health, but that could be a whole other webinar. So just I wanted to point out system change really is about how we change what holds the problem in place. And I'll reference an article that I really recommend each of you read. So what holds the problem of older adults falling? What's holding that in place? So when we look at root causes, it may be something specific to the older individual. It may be something related to their environment in which they live. It may be specific to medications that they're on. So there are many reasons or things that hold the problem in place. So what we're hoping to do with Stay on Your Feet and the work we do with home and community care is change the odds. So really change the system, change the policies, practices, and protocols so that people can actually reduce the odds of falling, because falls prevention and injury prevention is integrated into the work that we do every day. It becomes part of the everyday effort that we make, that just like you would take someone's blood pressure, you're also dealing with things that can prevent a fall. And it really is important, and this reflects on the full continuum, that it really comes from a cross-sectoral collaboration, that not one organization or intervention will actually make this difference. So the work with home and community care is part of a bigger strategy, an important part of the strategy. We're doing some other work in long-term care, and Frida and I may be coming back to present on it in the future. But we really are about making sure that it's not just one intervention and one partner. It has to be multiple partners and multiple interventions. Kathy.
So in this particular slide, we wanted to demonstrate the benefits that were derived from the various milestones that were achieved over the past 3 years. So in 2016, Wendy, who was the Northeast LHIN's population health lead, as we've mentioned, joined the RNAO Best Practice Guidelines expert panel. And the benefit attained there was knowledge, because she had firsthand knowledge about the best practice guidelines, and she was able to increase home and community care's awareness. In May of 2017, the Northeast LHIN and the Northeast CCAC, or Community Care Access Center, became one organization, and the benefit there was integration. In September of 2017, when the new RNAO Clinical Best Practice Guidelines preventing falls and reducing injury from falls became available, we took this to be an opportunity. In 2018-19, Home and Community Care's Quality Improvement Plan included change ideas for integrating the RNAO Best Practice Guidelines. And this benefit was alignment. Home and Community Care, as you're likely aware, submits an annual quality improvement plan to Health Quality Ontario. And in 2018-19, we did include some change ideas to improve our falls rates for our clients, one of which was to perform the gap analysis. And that gap analysis tool was very valuable, and we'll talk a little more about that later in the presentation as well. It allowed us to examine our current state in order to integrate the best practice guidelines and to reduce injuries from falls within our policies and procedures and our frontline practices. And then also in 2018-19, the new Northeast LHIN was preparing for a primer accreditation on-site survey. And this, the benefit again was alignment. The primer standards specific to home care services spoke to our need for a coordinated approach for falls prevention. And in the most recent home care service standards for accreditation, we are to assess for safety risks in our clients' homes, one being slips, trips, and falls. We must also develop and implement strategies to mitigate these risks with input from clients and families. And our care coordinators are completing home safety risk assessments. They're counseling clients and families about modifying their environment to ensure that any identified risks for falls are being mitigated. And our service providers are also performing visual scans and using some assessment tools that, that they require their own employees to complete. And then last fall, in October 2018, we formed our Falls Prevention Quality Improvement Plan, or QUIP, work group, and we followed the gap analysis tool. And what that enabled was some internal teamwork, and we were able to speak about our membership later in our presentation, as we will speak about them, because it was really what the working group and its members that made the work for this initiative very successful. In January of 2019, we also had public health unit expertise added to this QUIP work group, and that enabled system teamwork. And then in March 2019, our work plan was completed, we signed it off, and we continued to track and monitor and accept feedback. So with any change management project, there's always some challenges to implementation. For us, we were a newly amalgamated organization. We were still trying to figure out how to work together, and we were being accredited as a new organization. Some staff had reported that falls prevention at the time when we started this work was not even on their radar, and they did not really take ownership of their need to ensure that falls prevention was a focus in some work, but not all. A care coordinator going into a patient's home also has many areas of focus, and assessing for falls risk or implementing falls prevention strategies is just one of many other priorities when they're addressing the patient's care needs. Health Quality Ontario last year too, when they put out their priority indicators, we noted that falls prevention was not one of the priority indicators, although we know we can build upon the prior year's work. So we were a little worried though that our falls prevention work may lose its importance and the momentum, because as we know, what gets measured gets done. So we had to look at how we might ensure that it remained an area of focus for us. One of the enablers is leadership. It's one of the most important factors for successful implementation of any quality improvement initiative or when change in practice may be required. Shared leadership is practice owned and it's organizationally supported. And leadership must come from different levels in the organization. It's important that team members that are leading demonstrate a number of generic implementation skills, and we felt that it was important to outline these. But it's supporting employees. They needed to provide feedback. They needed to communicate about what we were going to implement, influence the work context, and they needed to serve as a role model and live the values of the organization. The LIN as an organization provided leadership to prevent falls with some dedicated funding and staffing for the Stay on Your Feet program based on regional need. The Northeast LIN's Population Health Lead was asked to be a member of the expert panel, as we mentioned earlier, and to develop the RNAO's Preventing Falls and Reducing Injury from Falls Best Practice Guidelines. This enabled her to keep up to date on the evidence and easier for her to bring it back and facilitate integration as she had been immersed in it for the past 6 months. The recommendations included the RNAO Best Practice Guidelines for Practice. They're based on research, best available evidence that was and is important to communicate when we're engaging. So why is recruitment? Another enabler for us was our recruitment efforts and having the right members at the table. We thought about the knowledge, the skills, and the wisdom, and what connections can team members bring to inform our discussions. We had representation from across the Northeast LIN's home and community care. We included frontline, we included managers, directors, the population health lead, and we also had the accreditation core team. Our accreditation leads actually were very important to this work. They had expertise in navigating and maintaining forms and documentation in the home and community care portal, and they could bring historical information, and they helped to identify the current state and to incorporate any necessary changes. They knew where to put the information, and we had a participant with frontline experience in care coordination. Our accreditation manager was in a temporary role, but she was a frontline care coordinator, and this was really great because she was able to help us to evaluate what would work in practice. And we had some really great subject matter experts that could lend expertise and provide input in all sections of the gap analysis tool. If there was a need, others were consulted and there was input was provided to the working group. For example, we had dietitians, we had therapists, and we had frontline care coordinators who are nurses. We did reach out during our completion of the gap analysis to explore what our service provider organizations were also doing for falls prevention, and as we attempted to define our current state in order to reach our future or our ideal state.
Thank you, Kathy. I'd like to expand on the work we do with respect to the partnership. So we have a wonderful group of individuals coming together, and it was, as Kathy pointed out, a very comprehensive group because we have a very large geographic area.
Sorry, Wendy, can you just let us know which slide you want to be on right now?
We are on enabler called alignment. It's not about you.
Okay, great. Just let me know when you want me to move the slides, okay?
Thank you. So we're talking about alignment. One of the things that within our Stay on Your Feet strategy, as we're looking to build partnerships, and I know that many organizations that are looking at building partnerships and getting others to support an initiative have learned this the hard way, and we continue to learn it the hard way, that when you're looking to work with a partner and integrate work that's important to you, of course, falls prevention is very important to stay on your feet. It has to be, you have to come at it in a way that it's in alignment with what the organization's mandate is. And so that's why when Kathy talked about this, the timeline, you would see alignment as a benefit. And so it's really important that when we were coming to work with Home and Community Care, as a new entity, we were a new organization, the door was open. It was an opportunity for Stay on Your Feet as a strategy to step through and build partnerships with our new colleagues. It was really about better understanding what was important to Home and Community Care. And as Kathy pointed out, one of the leaders actually at one point said, falls is not even on my radar. And that set me back on my heels when I heard that. And it really resonated that we really need to come at it from what's important to the organization. So if you take anything away from today, it's if you're looking to partner and get others involved in something that's important to you, you have to figure out what's important to them. So in the box at the bottom, it says, you care about this issue and are leading an initiative. How can we support you? So Kathy pointed out, we had alignment, we had new organization, we had the QUIP, accreditation, and we also had the LIN as an entity now with Home and Community Care and what we would still refer to as LIN Legacy under one roof. So that alignment needed to be about Home and Community Care. How would Stay on Your Feet help Home and Community Care meet their needs regarding the QUIP? LIN had never created QUIPs in the past. That was not something we did. We were never under accreditation. We weren't a service provider. So the door was open. And so we came in looking at how can we help you with this work and not here, help us do our work. So one of the other enablers, we're onto the short, focused, and facilitated slide, is I can't say enough good things about the RNAO gap analysis tools. And for those of you who've used them, are familiar with them and understand their utility. We used it, it was very much a multi-purpose tool for us. We used it to assign homework to the group before we would have a meeting, and all our meetings were teleconference. We had staff all over the region, so we never actually sat in the same room. Kathy and I were fortunate we got to sit in the same room a couple of times. We used the gap analysis as homework. We also used it as our meeting agenda. It's all there. Gap analysis linked nicely to the best practice guidelines. You can walk through it, just recommendation after recommendation. And it also became our meeting documentation because of the way it's established. So it may seem simple, but really the gap analysis tool, if you haven't used them, it is a wonderful way to get people focused on something that's important and actually looking at the evidence. So we tried to have 4 short focus meetings. The people who were coming, they had lots on their plates. They were actually, dealing with clients and dealing with providers. So sometimes they didn't show up because there were things going on and we had to keep going. We assigned homework between meetings, and we, as Kathy talked about, we assigned tasks to the right people. We had a wonderful young woman who was part of our group who knew the ins and outs of the portal. Kathy and I know very little about the portal, but without her navigating that and helping us and telling us how to put it in and get it working, we would not have gotten as far as we did. And we were able to complete this work in about 6 months. So this short focus and facilitated really links back nicely to what Kathy's talked about in terms of wise recruitment. Oops, sorry. So Kathy's going to talk about gaps to the work plan. So what did we actually do and what did we actually find out?
So the gaps identified through the completion of the gap analysis, as Wendy mentioned, we transferred those gaps to a work plan, which was posted on our internal portal so that we could have all working group members access that work plan and make it visible to all internal teams. And we did not have a clear understanding at the start of our work of what our service provider organizations practices were around falls prevention. And thus, this gave us an opportunity, another item that had been identified through our completion of the gap analysis. And we asked them to share their practices with us, as I mentioned earlier in our presentation, and I'd asked them to share any patient handouts that they might be providing to patients and their families so that we could try to align our key messaging so that, you know, we're serving the same clients. We don't want to have conflicting messaging. So one of the other opportunities, I guess, through the gap analysis that was identified was knowledge transfer sometimes to our frontline staff. So one of the items that we were able to carry out is some more education was provided to the care coordinators about stay on your feet and stand up classes and exercise classes and where to access that information so it could be shared with clients and their families. We created a shared resource that would cover the region. It's called the Guide to Living Independently for Older Adults. And we also increased awareness amongst the care coordinators regarding falls prevention resources that are available to the patients and families. We also encouraged our care coordinators to consider appropriate referral for dietary interventions to optimize bone health. Ask the care providers to consider adding, you know, vitamin D, etc. And we tailored education around the universal falls prevention strategies to staff. Now, the new RNAO best practice guidelines have an appendix. I think it's Appendix K, if I'm not mistaken. It talks about universal falls precautions. And so for the home and community care staff, there may not be a call bell, but what of that list could we be considering in home and community care? And we shared that with our care coordinators. And then we updated the falls prevention strategy document that we have in our policy and procedure manual available to the home and community care staff.
So one of the things I wanted to note about the meetings, and because I don't work in home and community care, it's Wendy speaking, is I had a lot to learn about processes. And I do reflecting on the meetings, a lot of the time, because we had such a nice diverse group of people, it was talking about, well, what is it that we do? And because we have such a big organization, it was interesting to hear some of the different ways people were handling the situation depending on what community they were in. We serve a very significantly rural, small town communities, and so we learned a lot of differences between what was happening in what would be the urban centers, like Sudbury is probably our biggest center, and what would actually work in some of our smaller communities. So it was interesting that it was a lot about, well, what is it we do related to this recommendation? And so it was a lot of learning for myself, but it was also good sharing among the different partners on our work group. So I'm on to the enabler called System Partnership, because our webinar is talking about how do you integrate best practices through partnership. So the partnership would be multiple, in that Stay on Your Feet is now a partner, and Home and Community Care is now a partner in Stay on Your Feet. And as I mentioned, that we're really talking about public health as an important partner. And so change makers must, and I've talked about this before, but I wanted to reiterate it. It comes from a document that I highly recommend you read. If you haven't read it, it's called The Water of System Change. And I think if you Google it, you'll find it. And if you can't find it, let me know. And I've read it many times, and I take away something from it every time I read it. And it's about shifting the conditions that hold the problem in place. And it's about looking beyond single organizations to understand the system by identifying all the actors to touch the issue. So going back again to our continuum, we all have a role to play. So stay on your feet as a strategy is really about 5 key things that we use in almost everything that we do. It's about strengthening community action. So making sure that we have the partnerships, that we have a good working relationship with our partners, home and community care, developing personal skills. So using the best practice guidelines as an education tool, using the gap analysis as an education tool, creating supportive environments. Kathy talked about the fact that universal falls precautions were important, that we wanted to make sure it was incorporated into the work that we were doing. And then it wasn't just about older adults living in their home. Older adults also come to the organization in different places. So making sure that we look at all the places where home and community care may interact with an older adult. Building healthy public policy. Well, we're really about taking the best practice guidelines and filtering home and community care's practice and protocols through those guidelines, and making sure that we are aligned as an entity that touches 8,500 older adults every day with the best practices. And of course, because Stay on Your Feet is about prevention, is really trying to reorient on prevention and not being ahead of it and not behind the fall before it happens. Next slide. I wanted to say a little bit about public health. They are a system partner. We have a unique relationship with our 5 public health units. Just a reminder of public health, you'll see it on the slides, that they do focus on the whole population, but they also address health across the life course. Again, back to the continuum. They do bring some significant expertise. I am a previous health promotion person in public health for over 20 years. And they do bring a really unique expertise, and we relied on our Nipissing public health lead in Stay on Your Feet, Lorna Desmaris, to actually help us develop a new guide called the Guide to Living Independently for Older Adults that would satisfy the needs of the care coordinators and the kinds of information they want to get into the hands of the family and the client. We also introduced to home and community care a new home safety checklist that we use in Stay on Your Feet. And one of the key things that happened through our partnership and working with home and community care is we finally made it more understood where the free exercise classes are and what is a stand-up class versus what is an exercise class, and where they can find out information about it. So we were able to tie up some loose ends that had been kind of flapping out there for a while, so that we could help home and community care get better access to the things that were available to them and to their clients. I'm on to next steps. So monitoring and tracking implementation, I'd say we need to do better on this one. Kathy and I were putting the presentation together and wow, we better go and do some circling back, and started to realize that we do need to do that. One of the things that is something we need and we need to develop or find is we'd like to have a very short focused learning module on fall prevention for staff. I know there's a variety of different modules out there, but we're really looking for something short, simple, and something that they can do in about 10 minutes. So if anyone out there has one, please let us know. And keeping our resources and programs up to date. That is something that is ongoing. It never ends. Next slide is, just wanted to summarize the RNAO best practice guidelines. I can't say enough about them, and I'm not a nurse by training, but I find the best practice guidelines are so well done, so well researched, so well maintained, that it's sad to see that some of them may not be being used. I'd love to see all of them being used across the Northeast, but for me, the falls prevention one is one that's near and dear to my heart. It brings the evidence right to your fingertips. And what we've been doing is using that document as a start for discussions with our partners. And then you can review it against current state. And that's where the gap analysis tool comes in. It can be used as your agenda, your homework, your documentation. And the other part I wanted to note is that preventing falls is a systems issue, which I think you've heard me say more than once, and it needs a system approach. So I wanted to let everyone know who's on the call today that there is a new Ontario Fall Prevention Collaborative that's been meeting for a while now. that's currently facilitated by the Ontario Neurotrauma Foundation. And so this group, in a nutshell, is trying to make sure that falls and preventing falls is identified and seen as a really important way that we can end hallway medicine, and that it's a very important part of keeping our communities healthy, active, and vibrant. So if you're interested in any more information on that, you can certainly reach out to me and we can talk. And just a reminder, it does take a community and that everyone has a role. And this month is Falls Prevention Month. And you can get more information on Falls Prevention Month at the link that I provide there. Last but not least, the last slide is about a call. If you're interested in learning more about falls prevention, this is also an opportunity for you to join the Falls Prevention Community of Practice called Loop. It's an online, easy to join, easy to use, and I know I use it as much as I can because it's a way to ask questions of those who are part of it and get lots of information and networking. And they also have information if you're looking for a journal article on falls prevention or best practice regarding falls. They also have that service, which I find very, very helpful. So just a little shout out to Join Loop. It's a wonderful resource and it's free. And all you need to do is just go to fallsloop.com. And Kathryn and I are happy to answer any questions you might have about the work we've done. I know we've kind of taken it from a systems approach right down to what we've done in home and community care. And then we've looped it back up to really, it's all about everyone doing their part, including making sure provincially that we know that falls are predictable, preventable, and that we can reduce injury and we can reduce hospitalizations if everybody does their part. Would you like to add anything else, Kathy?
No, I think you've pretty well wrapped it up there, Wendy. Thank you.
Thank you, Frida. We'll turn it back to you.
Well, and thank you, Wendy and Kathryn, for the excellent presentation. And I always get thrilled to listen to the work and see some of the work going through the processes and everything. And it's been just, it's always a privilege to hear it, the positives. And it's interesting, you did make a comment just before I open it up to questions. You did make a comment about the Falls Collaborative, and it was just interesting this morning because I saw something come through of an opinion of Dr. Frank Molnar from the University of Ottawa, who is part of, I believe, the collaborative, and he said failing to plan means planning to fall. And I thought this little opinion thing spoke very well to what you and Kathryn spoke to about somebody going, falls is not even on my radar.
Yes.
And we run into that. So we'll take a few minutes to answer any questions. I do see we have a question in the chat box that's from Christine that says, where can we find the Northeast Lynn exercise class schedules? I was looking this morning and couldn't find an updated one.
They are on the Northeast Lynn's website. You can, if you go on the Northeast Lynn's website, and right on the front page, you'll say stay on your feet on the bottom. You click on that and you'll come to a page and you'll see exercise class button. Just click there. It will also be available, it's also available on Healthline.
Great. And I'm just curious, Wendy, how did you gain the support from public health units? And are there other health units that provide this type of support across the province?
Public health units, as many of you will know, have standards called the Ontario Public Health Standards. And they were just revised and renewed. And as part of that, injury prevention is part of the public health mandate. One of the things that's a little different with the standards these days is that public health units can have more flexibility to identify who are their key target audiences. And so in order for the LHIN in the Northeast to ensure that we had public health on board, because they really are, I'll say, boots to the ground. They cover our whole district, but they're actually in the different regions, districts that we make up our region, is we actually have a memorandum of understanding with our 5 health units, and we do provide annual funding. So it's, if you're a public health unit and you're on the line today, I liken it to 100% funding. That funding ran for 3 years, and we just had it renewed for another 3 years. And we have funding, a commitment from our LIN until March 2021, so that we can have dedicated staff from the health units on the ground working with local coalitions, local seniors, local providers, because it really has to be something that's happening at all levels. And so that's how we got our public health units on board, and we do fund them to do it. But it is part of their mandate, and a number of health units are involved in falls prevention without the funding. There are about, I think, 32 health units, if I'm correct. But we are actually in a funding relationship with our 5 public health units.
Great. Thanks, Wendy. So I guess it's 12:45 and our time is up. Thank you everyone for participating in the webinar from the chat box. It was a great indication of the different sectors that participated today, from long-term care, acute, hospital, home care, community, family health teams, and as well as participants in different roles, educator role, rec therapy and such. So thank you everyone for joining. As you can see, Andrea did put up that you will receive a link to an online survey to evaluate today's presentation, and you can also make suggestions for future information sharing topics. Once you've completed the evaluation, you'll receive a certificate for your attendance, and you will also get a copy of today's presentation and webinar recording that will be posted on the RNAO website. And I think that's it. Have a great day, everyone.
Thank you, Frida.
Thank you.
Thank you. Thank you, Andrea.
I feel bad that week. There was no